This drug, Zydelig, is used to treat a specific type of cancer called chronic lymphocytic leukemia, CLL. It belongs to a group of drugs known as kinase inhibitors, and it works by slowing down or stopping the growth of cancer cells. The recommended daily dosage and optimal timing for taking this medication should be discussed with your doctor. Before taking Zydelig, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. You should take this medication by mouth as directed by your doctor, usually twice daily. It can be taken with or without food. Remember to swallow the tablets whole and do not chew or crush them. The dosage of Zydelig is based on your medical condition and how you respond to treatment. It's important not to increase your dose or take this drug more often or for longer than prescribed by your doctor. It's also crucial to note that Zydelig can be absorbed through the skin and lungs and may harm an unborn baby. So, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets. Possible side effects of Zydelig may include diarrhea, headache, heartburn, mouth or throat sores, and trouble sleeping. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's important to note that while using this medication, there may be serious side effects. However, your doctor has prescribed this drug because they have determined that the benefits to you outweigh the risks of potential side effects. Your doctor will carefully monitor you to decrease your risk. Be sure to notify your doctor immediately if you experience any serious side effects, such as easy bruising or bleeding, swelling in the hands, ankles, or feet, or sudden changes in vision. Idelalisib, the active ingredient in Zydelig, may cause a rash that is generally not serious. However, it's important to seek medical help right away if you develop any rash, as it may be a sign of a severe reaction. It's also important to be aware that this medication can weaken the immune system and increase the risk of infection, including a rare but very serious brain infection called progressive multifocal leukoencephalopathy, PML. Seek medical help immediately if you experience symptoms such as clumsiness, loss of coordination, weakness, sudden changes in thinking, difficulty talking or walking, or seizures. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed above, contact your doctor or pharmacist for further guidance. Zydelig, also known as idelalisib, is a medication used to treat certain types of blood cancers. It's important to be aware of the potential side effects and complications that may arise while taking this medication. First and foremost, idelalisib may cause serious liver disease, so your doctor will regularly monitor your liver function. If you experience symptoms such as nausea, vomiting, loss of appetite, stomach pain, or yellowing of the eyes or skin, it's important to notify your doctor immediately. Additionally, this medication can lead to severe diarrhea and gastrointestinal perforation. If you develop persistent diarrhea, abdominal pain, blood or mucus in your stool, fever, nausea, or dizziness, it's crucial to seek medical attention promptly. Furthermore, idelalisib has the potential to cause severe lung problems, such as pneumonitis. If you notice any worsening cough, shortness of breath, trouble breathing, or wheezing, it's important to contact your doctor right away. It's also important to be aware that this medication may lower your ability to fight infections, making you more susceptible to serious infections. Your doctor may prescribe an antibiotic to help prevent infections during and after treatment with Zydelig, so be sure to follow your doctor's instructions carefully. If you experience any signs of infection, such as a persistent sore throat, fever, chills, cough, or swollen lymph nodes, seek medical help promptly. It's crucial to take Zydelig exactly as prescribed by your doctor and to promptly report any concerning symptoms or side effects. Before taking Zydelig, it's important to let your doctor or pharmacist know if you have any allergies. This medication may contain inactive ingredients that could cause allergic reactions or other problems. You should also inform your doctor or pharmacist about your medical history, especially if you have liver disease, lung problems, or stomach/intestinal ulcers, or if you have a current serious infection. Zydelig can increase your risk of getting infections or make current infections worse. It's important to stay away from anyone who has an infection that can easily spread, such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, make sure to talk to your doctor for more details. Before using Zydelig, you should talk to your healthcare professional about immunizations and vaccinations, and avoid contact with people who have recently received live vaccines, such as the flu vaccine inhaled through the nose. To lower the chance of getting cut, bruised, or injured, be cautious with sharp objects like razors and nail cutters, and avoid activities such as contact sports. If you are an older adult, you may be more sensitive to the side effects of Zydelig. If you are pregnant or planning to become pregnant, you should not use Zydelig, as it may harm an unborn baby. Women using this medication should ask about reliable forms of birth control during treatment and for 1 month after the last dose. Men using this medication should ask about reliable forms of birth control during treatment and for 3 months after the last dose. If you or your partner becomes pregnant, it's important to talk to your doctor right away about the risks and benefits of this medication. Since Zydelig can be absorbed through the skin and lungs and may harm an unborn baby, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets. It is unknown if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding while using this drug and for 1 month after stopping treatment. It's important to be aware of potential drug interactions with Zydelig, as they can change how your medications work or increase your risk for serious side effects. This is not a complete list of all possible drug interactions, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Zydelig are bendamustine, as well as other drugs that weaken the immune system or increase the risk of infection such as natalizumab and rituximab. It's also important to note that other medications can affect the removal of Zydelig from your body, which may affect how Zydelig works. Examples of these medications include rifampin, phenytoin, carbamazepine, St. John's wort, among others. Additionally, Zydelig can slow down the removal of other medications from your body, which may affect how they work. Examples of affected drugs include daridorexant, domperidone, elacestrant, finerenone, flibanserin, ivabradine, lurasidone, mavacamten, midazolam, pacritinib, sparsentan, triazolam, among others. It's important to discuss any concerns about potential drug interactions with your doctor, as they can help determine the best course of action for your specific situation. If you believe someone has taken too much Zydelig and is experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact your local poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, reach out to your provincial poison control center. It's important not to share Zydelig with others. Before starting this medication, you will need to undergo lab and/or medical tests, such as liver function and complete blood count. These tests should also continue while you are taking Zydelig. Remember to keep all of your medical and lab appointments, and consult your doctor for more information. If you forget to take a dose of Zydelig, you should take it as soon as you remember, unless it is within 6 hours of your next scheduled dose. In that case, you should just skip the missed dose and take your next dose at the regular time. It's important not to take a double dose to make up for the missed one. Remember to always follow your healthcare provider's instructions for taking Zydelig. It's important to store Zydelig at room temperature in its original container, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly dispose of the product by consulting your pharmacist or local waste disposal company. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.